Hi, we're joined today by Dr. Chris Hall, who's a family physician with Beacon Medical Group. We're going to be talking about precautions and really reminders, things that you should keep in mind as we're moving through these uncertain times. Dr. Hall, thanks for joining us today.
You're welcome.
Let's talk a little bit first off. You know, a lot of us have to get out to go to the store, to go out in public every once in a while. Not all the time, but every once in a while. And if we do, talk about the precautions that we still should be taking today as we're several weeks into this and still potentially looking at an increase in the number of people we see with signs, symptoms of COVID-19.
You know, I think it's probably just important to just assume that anybody you come in contact with is going to have coronavirus. Um, it's certainly it's been in the news that there hasn't been enough testing, and we're seeing that as physicians that we don't have access to test the results that are going to come back very quickly. So we don't know who's positive and who's not. Especially, I've read articles that there could be 50, 70, maybe 75% of patients with coronavirus that are asymptomatic. So they feel fine, they think they're healthy, and you could come across them at the grocery store or at the home improvement store and not even realize it. And you could catch coronavirus from them. So I think it's important just to assume that everybody you come in contact with has it.
And so what are some of those things that we should be keeping in mind? The 6 feet distance apart from anybody else, what else would you say is important?
Yeah, the physical distance is important, because from what we know, coronavirus, not only coughing and sneezing do you spread it, but just people cough or people talking, people breathing. They may release coronavirus out there, and the closer you are, the more likely you're going to catch it. I think it's important to be mindful of other exposures too. If you're at the grocery store and you touch a shopping cart, for instance, you may get it on your hand because coronavirus can live on surfaces for several days, depending on the situation. If you go to the gas station and put the gas pump in your car, you could get coronavirus on your hand. If you go to the ATM machine may have coronavirus. So it's important to wash your hands too.
Yeah, and so gloves, I know I've seen a lot of people when I go to the store wearing both gloves and masks. Talk just a little bit about what wearing either of those could help both you and the people that you're with.
So the gloves first. I don't know how much the gloves really help, because if you're coming in contact with surfaces that have coronavirus, and if you're going to be washing your hands, you're going to get rid of that contamination. When you have gloves on, you still have the coronavirus on your hands, and you can spread it even further when you're taking the gloves off. So if you're very cautious about it, I think those may be helpful, but um, the key is really in the distancing, and also the masks too. There's been a lot of different recommendations from groups on the masks that you shouldn't wear them. Now we should. Wear the N95 masks. No, we need to wear the cloth masks. And a lot of it has to do with supply. What's available at the time. But I think that using any kind of mask will help. It will decrease how much of the virus we're spreading, and it will also decrease how much we're breathing into our system too.
There's probably nothing wrong that you can do in terms of wearing masks, wearing gloves, and just being extra cautious. We're all starting to go a little stir crazy with this quarantining. So why is it still important today to remain, I don't want to say isolated, but separate from other people? Why should we still be staying home, staying away from others? Why is that so important still today?
Um, I get it. I'm feeling just as stir crazy as everybody else. And it's we're 4 or 5 weeks into this now, and it's very easy to get complacent. But the trouble is here in Indiana, we just had our greatest number of newly diagnosed cases just 4 days ago. So we're either at the peak or we're nearing the peak. We're close to it. And so there presumably are more people walking around with coronavirus right now than there were when we went into self-isolation. So it's more dangerous now, not less dangerous. So, I think it's very, very important that we realize that, and especially as the weather gets nicer and we all get more anxious to get outside, that we try to still maintain these restrictions that have been put in place.
Was going to say the fresh air is good for us, but still keep that distance
It is,
and
yes.
yeah, just keep those reminders in the back of your mind. If you have a true medical emergency, I did want to ask you to offer your advice because at the same time that we're social distancing, if you have a true medical emergency, Beacon is there for you. Talk about that.
It's, unfortunately, even though, we have the quarantine in place, life still goes on. People still get sick. Um, Accidents happen. And so we still have to be there for our patients, and we're still there for our patients. Obviously, if there is some kind of a medical emergency, the hospital, the emergency room is still open. They're still seeing patients. And granted, they've tried to make room for those ill coronavirus patients, and they're taking care of them, but they still have, they're still seeing all the other uh, patients that walk in the door too. Even the offices, we've stopped seeing routine patients, but we have limited hours for the more routine visits, or I'm sorry, for more like sick patients,
Okay.
when people are still getting sick this time of year, and so we want to be there to help. Then there's the midpoint too, that I think serve as a good buffer for those people that either don't have physicians, or for people that can't get into their physician offices for one reason or another. They've just set up some new facilities outside of each of the med points where they're going to be able to see patients that potentially have coronavirus and keep them out of the same area where people are with sprained ankles or that need sutures or something like that. So preventing contamination of those otherwise healthy.
Yeah, so if you're sick, there's no reason not to call ahead or call your doctor, or again, if it is a true emergency, to go to an emergency room as if you would in normal times.
And I think that the best place to start, everything is different. We all have different hours and different ways that we're triaging patients. Start with your doctor's office. Give them a call and say, "Hey, I've got this going on. Where should I go? How should I start?" And sometimes they can handle things over the phone. At Beacon, a lot of us are starting to do these telehealth visits, and so maybe it's something you can manage over a video screen like we're doing today. Maybe you need to go to the emergency room. So there is no harm in starting with your doctor.
Dr. Hall, thanks so much for these reminders. Again, hopefully we're going to be seeing the numbers start to decrease and we'll all get back to normal over time. But in the meantime, great reminders. Thank you.
You're very welcome. Take care.